So, Sunitra, is it time already? I think it's 2 o'clock.
Yeah, it's 4 o'clock, and Chaitali, if I may please request you to
We'll start on time, please.
start the webinar.
Yes. All right. All right, we begin. Good afternoon, everyone. This is Chaitali Phadke from India Sanitation Coalition FICCI. Welcome all of you all to this presentation today. And before I hand it over to Meenakshi Diwan, the CEO of India Sanitation Coalition, some ground rules that I want to say that please rename yourself if your name is already not mentioned, your original name is not there. Second, please relay your questions in the private chat box to either Nitya Jacob or to Sunetra Lala. Also, this presentation is being recorded. And yes, now over to Meenakshi Diwan, please.
Thanks, Chaitali. Hello, everyone. Welcome to today's webinar on addressing stakeholder concerns around testing sewage for COVID-19. I'm Meenakshi Diwan, the Chief Executive for India Sanitation Coalition. Just wanted to share a couple of words about India Sanitation Coalition for those who may not be familiar with us. India Sanitation Coalition has been operational at the Federation of Indian Chambers of Commerce and Industry, FICCI, for about 5 years now. Our coalition enables and supports safe and sustainable sanitation by bringing multiple organizations on a common platform through a range of catalytic actions. These actions range from efforts to unlock WASH financing with a focus on the private sector to convening, curating, and disseminating best practices in the sanitation advocacy space and providing input into the policy aspects of sanitation through participation at allied forums. Today's webinar, addressing stakeholder concerns around testing sewage for COVID-19, has been jointly organized by the India chapter of the Sustainable Sanitation Alliance, SASANA, IRC, WaterAid, and the India Sanitation Coalition. When COVID-19 became a pandemic, we debated how people working in sanitation could meet the challenge. We decided to run a discussion on SASANA and a webinar to elicit information and comments that we shall use to support the government efforts to detect and manage the pandemic. We have had an overwhelming response to the discussion so far and look forward to a lively discussion here as well. With that, I have pleasure to introduce to you the moderator for today, Sunetra Lala. Sunetra has over 19 years of experience in multidisciplinary team management, applied research, capacity building, and knowledge and learning. Sunetra is the WASH sector leader for S&B Cambodia, where she manages projects across sanitation, rural FSM, WASH nutrition, governance, and pro-poor approaches. With that, over to you, Sunetra. Sunetra, you're mute.
My apologies. Thank you, Meenakshi, and a very warm welcome to everyone for joining this webinar today. It's been a pleasure to connect with you all and to facilitate the discussions going forward today. As we all know, it's almost been 2 months since the Indian government imposed the first phase of the lockdown owing to COVID-19. And this pandemic has required an emergency response from all sectors, from the urban local bodies to the states, and on several fronts, as we all know. And true as always, sanitation and hygiene has always been the strongest of weapons in any public health crisis. And several cities have initiated massive drives of sanitization of public spaces by deploying a large number of sanitation workers, frontline workers, amongst other initiatives. And there have been several government advisories as well, issued by the central government and state government to address the emerging challenges of urban water and sanitation. And as Meenakshi pointed out, the SASANA India chapter ran a very, very vibrant thematic discussion, as always, on protocols to test sewage as a mechanism for early warning about COVID-19. And there were several useful inputs for that discussion. Various respondents pointed out that experiences from Switzerland and Australia, the Netherlands, USA, and even Chennai in our own country suggest that sewage testing can indeed be an effective early warning system. However, the cost and feasibility of such a testing system ought to be faster and simpler and way cheaper than any other tests for COVID to be worthwhile, as right now there, as we all know, there are many competing needs and contesting for the same money, the same resources, and the same attention. What members also refer to in the thematic discussion is that, that there are inherent challenges in collecting samples in India, as sewer networks only cover certain parts of the city. It's not there in most of the small towns or slums and densely populated areas. And that poses a huge challenge. Also, what members brought out is, we need to consider the ability of institutions who need to take this testing forward. And oftentimes it's possible that, the institutions that are required to take this forward probably do not have the human resources or the funding to be able to conduct these tests. So this webinar, as Meenakshi pointed out, is a lead up to that thematic discussion. We have discussed the protocols and the SOPs that are needed to test sewage. This is looking at, how do you address these concerns that were raised by various members who participated in the discussion on how do you test for sewage for COVID-19, yeah? And these stakeholders could include, the decision makers, the health workers, the sanitation workers. Our panelists today will be looking at all of these issues. They'll be looking at, the public health implications of COVID-19 in sewage. They'll be looking at the health and safety issues of sanitation workers and frontline workers. And what does this mean for our urban local bodies? This testing, how to test, and, how can you address all of their concerns collectively to be able to test and the feasibility of testing. So before I introduce all of our panelists, if I may please repeat Chaitali's request rather, for everyone to mute your mics, and we will be taking questions, of course, after all of our panelists have an opportunity to speak. And so I would request you to raise your questions in the chat box, preferably only to me and Nitya. And then we'll try and see how many questions we can take forward. With that, I have the great pleasure now to introduce our distinguished panel members. We are joined today by Dr. Sitharaman, Ms. Malini Reddy, Mr. S. Vishwanathan, and Mr. Sharda Prasad. Our first panelist today is Dr. Sitharaman, Dr. M.R. Sitharaman, who is associated with the Swami Vivekananda Youth Movement, a development organization which is headquartered in Karnataka. He is also now serving as the national convener of the FANSA India chapter. Dr. Sitharaman is a public health practitioner and a development activist, and has led the implementation of many grassroots level initiatives on community development, including health, education, and socio-economic empowerment. Wash and environment are his areas of interest and expertise. Today, Dr. Sitharam will be talking about the health implications of COVID-19 in wastewater and sewage. My first question to you, Dr. Sitharam, and welcome to the webinar, is, does COVID-19 spread by fecal-oral transmission? And if so, then what is the significance of the presence of the virus in fecal samples? And what are the clinical implications of this? Over to you, Doctor.
Thank you, Sunetra, and good afternoon to all of you. So it's good to get opportunity to interact with all of you and learn more. These discussions will always be very vibrant and informative. Coming back to the question and keeping it crisp, a key issue there is whether the viral organism is present in the fecal matter at all and whether that is infective. It's still pretty early times. We have still not been able to be very conclusive about this, but there are many research studies which have thrown up very important and interesting information bits. COVID-19, the disease which is caused by the SARS-CoV-2 virus, as we all know, is predominantly a respiratory infection. It starts off with upper respiratory tract and then goes to the lungs and then spreads to kidneys and other areas. But what is interesting is that there have been many documented cases where the symptoms have predominantly been from the gastrointestinal tract rather than the respiratory tract with pain abdomen and diarrhea. Research has also now shown that there is definite evidence of the presence of viral strands in the fecal matter. In fact, some studies have shown that the fecal samples continue to be positive even after the throat samples become negative. That is, the respiratory phase is already over and the patient apparently is already well, but still the fecal samples continue to show the presence of the virus, the SARS-CoV-2. Now, this has been proved, but the next big question is whether this virus in the fecal sample is really infective. That is where the big doubt still is. That is where the big question still is, because as of now, there is no conclusive evidence of the transmissibility of the virus. So this is very similar to the other corona virus, the cousins of SARS-CoV-2, like the SARS-CoV-1 or other MERS virus, where though the fecal samples do show the viral strands, they are not proven to be infective, unlike unlike the virus in, let's say, the cough sample. So that is something that we need to remember. The clinical implications of the presence of the virus is not yet been 100% proven as being as infective as a saliva sample or a sputum sample. So from a individual clinical patient perspective, if there are predominant gastrointestinal symptoms, it's very clear that the fecal matter also is excreting, the patient is excreting the virus through the fecal matter. So it is coming out, but it is not yet sure whether it is really infective. So that is where we are in terms of the infectivity part of the virus in the fecal samples. Now, going beyond just the patient and looking at it from a public health point of view and looking at the wastewater and sewage. So there have been many studies across different countries, including Australia, China as well, and US, UK, and India also, where the sewage samples and wastewater samples have shown the presence of SARS-CoV-2. There are two key questions that come up in this. Where did this come from? So if there are patients obviously living in that area and they are excreting this virus, then we should be able to zero in using the appropriate mapping techniques to look at where exactly this is coming from. So that has its own public health significance. And then the next question is, where does it go from here? Does it really pose an additional threat to the handlers and the workers in that area? Or if there is a contamination of, let's say, a drinking water source or the environment itself, is it likely that it can perpetuate or perhaps amplify the intensity of the epidemic itself? As of now, these questions are being explored, but we still don't have a very definite answer. But in the medical parlance, we generally take the stand of being erring on the safer side. So we always talk of universal precautions. And so it would perhaps be very relevant to adopt the same principles and make sure that all the standard protocols, etc., are followed so that infectivity or not, we are very safe, because we know that the viral strands are anyway there in the fecal samples and in the sewage samples.
Thank you, Doctor. That was very informative. A follow-up question then is: we understand there's still quite a bit of gray area, like you explained about in terms of infectivity. But do you think testing wastewater can, in some ways, help in managing the pandemic?
Yes, there are definite advantages that this information can be put to use to. One, like I said, it's a good way of actually mapping out is if there is, based on how the sewage samples are centralized, how they are collected at different stages, if we can know where the sample is coming from, we will be able to zero in geographically as to which locality the samples are testing positive. So we will be able to geographically identify the areas where patients who are excreting the virus in the fecal samples live. So that would be one important thing. One other point to remember is that, as we have already heard, even the respiratory cases, the majority of them are actually asymptomatic. That is, they don't have fever, they don't have cough, but then they are bringing out the virus in their sputum, in their saliva. So there is actually a terminology which is called carriers. So we might have a carrier state even in this COVID-19 disease, which means that though the patient is asymptomatic, the patient harbors this virus and continues to spread this virus. He doesn't suffer. So, this is a proven situation in other diseases as well, like typhoid and other cases, other conditions. So, even after the peak of the disease epidemic has died down, if we continue to find certain samples as being positive for the viral strands, then we will be able to identify those areas where such carriers might be living, and we will be able to plan out appropriate safety measures so that it doesn't subsequently blow up into a new pandemic. Now, one other point is that, diseases like cholera, the epidemiological behavior of certain diseases is changing. Cholera used to be an explosive epidemic earlier, but of late it has been noticed to have a more endemic nature. So similarly, epidemiological surveillance will help us identify the behavioral patterns in natural history of certain diseases. So even if this pandemic is over, we can keep an eye on what is happening and be ready for any subsequent outbreaks as well.
Thank you, Dr. Sitaram, for kickstarting the discussions with your valuable inputs. I would now like to call upon Malini Reddy as our next panelist. Malini is associated with the Administrative Staff College of India, based in Hyderabad. She's a researcher and practitioner in the area of urban governance and service delivery, and has led several national and international assignments in the area of sanitation. And in the current context, in light of the COVID-19 situation, she is currently involved in research on developing surveillance systems for cities to detect the presence and prevalence of the virus, and to understand how best this information can be used for implementing measures. Malini will be talking about evidence-based solutions for urban local bodies to tackle the COVID pandemic today. Malini, welcome to the webinar. And my first question to you is, we can understand if there is a degree of reluctance amongst officials to talk about the possibility of finding COVID in sewage. So what can be done to create an environment, an enabling environment for testing this sewage my apologies, for testing for COVID in sewage. Over to you, Malini.
Very much. Am I audible? Hello.
Yes, Malini.
Yes,
You're
Malini.
audible.
Thank you. Thank you. Can I go to my second slide? Thank you. So I'll take 5 minutes to just talk a little bit about what we as an organization have been doing in our support to state governments, particularly the state government of Telangana and Andhra Pradesh, in managing liquid waste more efficiently. Now, in the light of COVID or otherwise, the type of waste that is coming out is of different kinds. And unlike in the West, where we would have grey water and black water coming out separately, unfortunately, what we really have flowing through our cities is a cocktail of, sorry for calling cocktails for you, but it's a cocktail of different kinds of waste which is flowing through the cities. So we have currently, in the context of COVID, we have biomedical washings and sewage coming out from institutions. So you would find that institutions which are designated COVID centers, they do not have treatment systems and are letting out waste directly into the open drains. We have households in COVID containment areas where you have insanitary toilets, which means the toilets are directly connected to the drains, and therefore all the waste is flowing through the town. You have septic tanks, but septic tanks don't function well. And in some of the studies that we have done with public toilets and community toilets, which have built septic tanks as per the CPHO guideline also, we found that there is fecal coliform in substantial quantities, which is being let out. We have gated communities which have STPs. Most of the gated don't have STPs, but the ones which have STPs also do not have a treatment, which is a systematic and a fluorination process before they let out. And unfortunately, it's not just letting out, but they actually reuse it for gardening. So just to Dr. Sitaraman's point, next slide, please.
Malini, if I may just come in, there are messages coming in saying that your voice isn't very clear, and I'm not hearing you very clearly either. And I wonder if there's something you can do about checking maybe your voice settings.
We try. Is this better?
I think so. I think so, Malini.
Yeah, I think, yeah.
Maybe if you come a little closer to the mic, Malini, that would be helpful. Thank you.
Yeah. All right. So I hope this is clearer. If it is not, then I will remove the mic and go on to the computer audio.
I think better now. You could go ahead. Thank you.
You can go.
All right. Thank you. So just building on what Dr. Sitaraman was mentioning about evidences and traces of COVID being found in studies which have been done internationally. But there are also studies in India which have been done, and they have found traces of fecal matter. However, these studies have been restricted to sewage treatment plants. And we know that the complex context of non-sewage sanitation that we have in India, we need to conduct this study beyond just at the sewage treatment plants. We know that there are urban poor living alongside drains, which is laden with COVID waste. They are at high risk. And the reason why ULBs are not moving forward with this testing, when they know that by conducting testing, they can establish a surveillance system and have a predictive modeling to be able to take better decisions. They're aware of this. However, in our understanding and experience of interacting with city and state government officials is that they see two issues. One, they are unclear as to how they should go about this. What are the testing protocols, particularly for COVID? That is one thing which is holding them back. Second, there is absolutely no guidelines which require them to take this up. That is the second issue. And the third issue is that if they find, that if they allow some studies to be conducted and they do find traces of COVID, how do they communicate this, or how does it get communicated in a way that it does not create further panic? Because already the cities are stretched in terms of how they are managing the COVID pandemic, both in terms of a public health point of view, migrant labor, so many issues. So this is one more thing which is really weighing them out, that how would the results of these studies be communicated? And this is, I'm happy that this will be a segue to the next line of discussion that we have on this forum. So given all this, is it possible for cities to take up? Yes, it's very much possible. We've been in contact with some private accredited labs in testing labs in Hyderabad. They charge 4,500 for testing the sample, and they are willing to come up with a sampling protocol, which can be vetted through partnerships with other organizations, international and national research organizations. Uh, the testing infrastructure is therefore available. Therefore, cost of testing, if you see, is going to be quite reasonable. And willingness to do is something that we have to work on. And we are happy to share with you that the state government of Telangana has only yesterday given us a go-ahead to conduct studies in cities of Hyderabad and Warangal, which are amongst its cities with the highest number of containment zones. And we are looking out for partnerships with people who would work with us, with the state government of Telangana, to establish a protocol as well as establish a surveillance system. Next slide. Now, while we wait for the results of these studies and to understand, as Mr. Sitaraman mentioned, about the infectivity, what would the cities do? I think it has been proven by various studies that the simple process of chlorination can help in dealing with the COVID virus in water as well as wastewater. So the cities, as we advise cities, our advice is that irrespective of what the results show and how long it shows, we should take precautions right now. So all centralized STPs need to definitely have the chlorination process as the last process. And currently they do not have, only some of them have. All decentralized STPs in apartment blocks. In fact, just as you have the water mafia, what we see right now is a wastewater mafia, because it's completely unregulated market. Any private operator can start an STP and establish an STP. There is no regulation, there's no testing, and even sanitation workers engaged by apartment blocks are at high risk because of this aspect. Equally important is to ensure that the public toilets and community toilets, the waste that they are letting out, doesn't have COVID strains in them, and therefore they must use materials to, not just for cleaning but also in their soak away pits. Fecal waste, which are the sludge, which is leftover sludge in the STPs, and the fecal waste coming from septic tanks, has to necessarily be treated in fecal sludge treatment plants, preferably thermal plants, so that you're sure that there is absolutely no trace of any virus left. PPP usage by workers, and other colleagues today would be speaking about it. But two things which is essential is the cities require clear guidelines from Government of India that yes, you must conduct this, and we must, as a collective, push ICMR to release these guidelines for testing and giving permission or pushing the cities to do it. And also, there should be some policy or some guidance from Government of India to say, ask the cities to establish surveillance system, particularly because you take the state of Telangana, we have the lowest test rates. So for a state like Telangana, it's absolutely essential that you have sewage testing and you have surveillance system which could predict the presence and prevalence of COVID traces in wastewater. So that's from my side, Sunitra, for the time being. Thank you.
Thanks so much, Malini. I think you've drawn two very important issues, brought them out. One, that of a lack of guidance or guidelines, which potentially impedes such a testing protocol, and the other of of the sanitation workers and how their safety and health becomes of paramount importance. Something that one of our panelists, Sharda Prasad, will be also discussing. Thank you for that. With that, I would like to invite our next panelist, Mr. S. Vishwanath, who heads the Biome Trust in Bangalore, to share his thoughts. Vishwanath has been working in the wash sector for the past 34 years. He also serves as a faculty at the Azim Premji University and has been working on areas of rainwater harvesting, sustainable sanitation systems, groundwater recharge, and sustainable water systems. Vishwanath will be discussing Bangalore's experience with testing for COVID in sewage. So I think, Vishwanath, over to you. And I understand you have a deck of slides to show, and we're very excited about understanding, what did testing in Bangalore reveal, and what does it mean really for such a protocol to be developed going forward. Over to you, Vishwanath.
Yeah, thanks, Sumitra. I'll quickly run through some photographs, some pictures, and also try and discuss what's happening in Bangalore, and especially with the formal as well as the informal sector. With the challenge of a metropolis, which is now 13 million in population, you have a combination of both formal systems of managing wastewater as well as of informal systems of wastewater flows in stormwater drains and pit toilets being removed by honeysuckers and being disposed of in undesigned FSTPs. The next one, please. Next. Yeah. So as already explained by Dr. Sitara, I think the latest thing is also we have to tread cautiously between spreading fear and being cautious, right? So the evidence seems to be that there's been no reports as yet of SARS-CoV-2 being transmitted via treated or untreated wastewater. This is one of the latest works done by Jackie Nee with WHO and CDC studies and global studies on SARS-CoV-2. Formally, what we have is we don't have direct guidelines from the government of India, as Malini Reddy was actually pointing out, but we have a CPHEO circular issued to the water and wastewater utilities and to the pollution control boards, which suggests that wastewater treatment should be followed by chlorination. And after about keeping pH less than 8, ensuring 0.5 milligrams per liter or 5 parts per million of chlorine after a contact time of 30 minutes. It also, the circular also suggests PPE for sanitation workers, plus health protocols for them, testing for health before they enter the wastewater treatment plant, plus hygiene, plus disinfection of contact surfaces in the wastewater treatment plants. So the CPHE was circular. It's not even mandatory. It's just a circular which has been issued. Is what is being followed by some water utilities. I'm not aware of in Karnataka itself that all water utilities are following this CPHE circular. Next one, please. Next slide, please. Yeah, so in the city itself, we have formally 28 sewage treatment plants, wastewater treatment plants being run by the Bangalore Water Supply and Sewerage Board, 3,500 decentralized sewage treatment plants, which are mandated for apartments and gated communities, layouts, etc. And of course, community toilets, which are being run by the municipality. Now, you can start to imagine that if you're going to try and identify epidemiologically the spread of SARS-CoV-2 or COVID-19, with 28 STPs, which are catering to essentially about 10 million people. The wastewater catchment zones are really huge. So we'll perhaps have to go down from the sewage treatment plant to manholes, manhole level identification, if we have to start to get to understand community level spread of COVID-19. Compounded is the fact that there are more than 500,000 on-plot systems, essentially pit toilets, some septic tanks. There are temporary toilets in labor camps and construction sites, and there are about 500 honeysuckers, which are in the informal sector, which are actually picking up this waste from these on-plot systems, septic tanks, and construction sites, and taking them to no formal FSTPs, but actually putting that in agricultural fields surrounding the city and sometimes in the stormwater drain. Next slide, please. So here's the other interesting thing. The design guidelines for wastewater treatment for now run with about 7 parameters as per the NGT ruling recently, which is yet to be decided by the Central Pollution Control Board, and 8 parameters as per the Karnataka State Pollution Control Board, which all wastewater treatment plants have to follow. But residual chlorine is not identified as a treatment, or chlorination is not mandatory in terms of the guidelines, right? So chlorination, even if it's mandated now, means that you'll have to start to build chlorination tanks. Contact time of 30 minutes means that they'll have to be large size or small size, depending on wastewater treatment plant. And the whole infrastructure will take a long time to be delivered, even for the 28 STPs, which are formally designed for certain standards. So it's not merely the issue of a circular, which will result in the chlorination happening, but a whole bunch of investment and finding space and making sure that the chlorination happens. Now, this we are talking about the formal system. And as Malini Reddy already explained, the informal system is even more lax. Next one, please. So here's one of the interesting things with Bangalore. The city is itself transferring 440 million liters of treated wastewater, secondary treated wastewater, with 1 milligram.
Just a second, if I may, Vishwanath, my apologies. I wonder if the screen can be made slightly bigger so we can read the figures there.
So the screen will be controlled by somebody else.
Yeah, Gaurav. So if I may please request you to do a full screen here.
So don't worry too much about the screen. This is just a rough indication of how treated wastewater is being transferred about 50 kilometers from the city. Yeah, so we'll go to the next slide, and then you'll get a visual representation of how the wastewater is moving to a vast hinterland, a hinterland of nearly 64,000 hectares. Yeah, so the treated wastewater, secondary treated wastewater with very limited chlorination, actually ends up in a lake about 40 kilometers away, called Lakshmi Sagara. To the left, you see the wastewater entering the lake, and that's how the lake is full of treated wastewater. Next one. Next slide, please. And consequently, by gravity and by pumping, a series of lakes are going to be filled up by the secondary treated wastewater. 50 lakes are now full, and eventually 134 lakes will be filled with secondary treated wastewater. So when we are worrying about COVID-19, we should also worry about the impact it will have in the hinterland, not merely the catchment from where the COVID-19 is coming. Next slide, please. So you see lake after lake is filling, and this treated wastewater is moving kilometer after kilometer. It will move to about 90 kilometers eventually from the city of Bangalore. Next one, please. And the treated wastewater is not to be used directly for an irrigation purpose. What is supposed to happen is that it will fill up the lakes and recharge the aquifers, and will then be picked up by farmers from shallow open wells or deep bore wells, and then be used for cultivation. So we now have to start to track many of the emerging contaminants as well as COVID-19, because we do not have standards for recharge of treated wastewater in tanks and lakes in India. We're still working through that. This particular project had to go through the Supreme Court, and the Supreme Court had to clear it, and it's still being monitored on time by the High Court for standards and for contamination of groundwater and other crop contamination, if any. Next one, please. And that was the formal reuse of wastewater. This is what's happening informally. Only about half the wastewater generated in the city is actually getting collected and treated. Roughly about 700 MLD is not. It will be up in the coming future, but still a significant portion of the wastewater in the city flows through stormwater drains and enters river systems like this. It's true of Hyderabad, it's true of many cities, it's true of Bangalore also. Next one, please. That's the informal wastewater, leaving it with the beautiful phosphates and industrial contaminants, including a cocktail of stuff, including viruses and bacteria. Next one, please. But this, after about 5 kilometers, is placid, like this. There's no foam. The environment has done its job. Next one, please. Next slide. And farmers informally tap into this wastewater, this untreated wastewater, through these kind of wells to the side of the river. This is the river Dakshin Pinakini. Next one, please. And from the wells, it's picked up and then pumped and used. This happens through a stretch of about 50 kilometers. And we believe that farmers are pumping this from the river to a distance of 7 to 10 kilometers, sometimes 22 kilometers, untreated wastewater for agricultural crops and vegetables. Next, please. These are the kind of pump sets that abut the untreated wastewater flows in these two rivers. Next one, please. This is how it's pumped and stocked up on farms up to 7 kilometers away, sometimes mixed with diluted borewell water, but sometimes just untreated wastewater in these ponds, because farmers have no choice. The groundwater has run dry and they have no access to other forms of irrigation water. Next one, please. And they grow millets, as you see here. They are very productively grown. The next one. Or rice. So it's not just vegetables, but it's also food grains that are grown by this treated wastewater. So here's a huge challenge with us with the emerging contaminants as well as COVID-19. Next, please. And of course, there are finally the honeysuckers. In our city, The honeysuckers are operating completely informally. There's no registration of them. There's no way that they take them to fecal sludge treatment plants. They're picking it up from pit toilets like this one. What about the PPE for these workers? What about the ultimate disposal point for this sludge? These would be the challenges that we'll need to face. Next one, please. So here's what I would finally like to end these last two slides is perhaps we should use the World Health Organization sanitation safety plan to develop a risk matrix for various kinds of wastewater flows. And based on what we think are severe, moderate, or minor risks, we should then be able to approach in terms of systematically addressing the challenges that COVID-19 gives to us. Next one, and the last one, last slide, please. Because what's the end game with SARS-CoV-2? Would it be herd immunity is what we are talking about? Is there a vaccine that we wait for? Or is this the new normal in which wastewater treatment plants and FSTPs would necessarily have to use chlorination as a permanent way of dealing with viruses, emerging viruses? So COVID-19 for now. Thank you for the time that you gave.
Thank you so much for this, Vishwanath, and running us through, wastewater management in Bangalore, and particularly drawing our attention to the problems of, the honeysuckers. And what we have thus far is a circular really, and not really a guidelines as such. A brief follow-up question to you, Vishwanath, is, with this vast range of sanitation systems, from on-site to centralized systems, which institutions in India really are responsible or are accountable for managing COVID risks that can be associated with water and sanitation? And that, of course, includes, the sanitation workers.
Waste that are emerging, including wastewater. The utility is the service provider, and the local body can also be the service provider in some cases. But it's up to the state pollution control boards to start regulating. Yeah, the dog wants to be let out. Sorry about that.
Clearly, your dog wants to contribute to this conversation, and we're up for it, I think. Well, thanks so much, Vishwanath. Our final panelist today was joining us from the US and has probably had a sleepless night, thanks to us. Mr. Sharda Prasad, thank you so much for joining us. I know it's an odd hour for you there. Sharda he serves as a professor, as an assistant professor, also at Azim Premji University in Bangalore. Sharda is a researcher and a sanitation specialist, and his areas of expertise is sanitation access in low and middle income countries. Sharda will be continuing where both Malini and Vishwanath led us through their conversations about the space for sanitation workers and the frontline workers, and what of their health and what of their safety. So Sharda will be delving into the very pertinent topic today, and that of which is, ensuring accountability for the safety and safety of sanitation workers, and how do we best address their concerns about COVID-19 infections. Welcome, Sharda.
Thank you, Sunita.
If I may start by asking you, this issue around the safety of sanitation workers is so old in India, and it's something that is often on the news. We see it so often, and it's heartbreaking, really. But do you think that, and the COVID really compounds that safety issue, right? Do you think that this situation, as it presents itself now, this COVID-19 pandemic, do you think it provides an opportunity to look at and to improve the safety and working conditions of these sanitation workers and frontline workers? And if that is indeed the case, who should pay for this, added safety and improved working conditions for them? Over to you, Sharda.
Yeah, thank you, Sunetra. So what I will be doing is, of course, this is, I'm glad that the presentations have been in such a way that we can just add to the previous presenters' points. And in my case, I want to focus more on sanitation work, particularly extending what Malini and Vishwanath actually shared with you. And Sunetra, I will come to your question towards the end of my presentation. Gaurav, do you think you can put up my presentation? So in my case, particularly, you can just start with the direct slideshow. Yeah. So in my case, I'm very much concerned about the spectrum of sanitation work itself, because though this particular presentation is focused on sewage workers, there is a huge, the spectrum is very wide in India. It starts with something like manual scavenging, which is slowly disappearing. But today, manual scavenging term has been extended to involve anything that involves any sanitation work that involves human contact with human excreta. So there is always that. But Gaurav, you can go to the next slide. But in my case, I want to show you that we don't even think about, this is a stormwater cleaning, stormwater drain cleaning in Delhi, right next to India Habitat Center. And as you can see, the water is pitch black. Gaurav, next slide. See the way people are working. And as Vishwanath and Malini, they have pointed out, India doesn't have the type of infrastructure where all our wastewater is managed in such a way that it enters our sewage treatment plant. So good amount of it actually ends up in our stormwater drains and they end up overflowing. Even our own sewer lines, they overflow. That's a different idea. So these are also the workers, but these are not sanitation workers. So when I interviewed them, Gaurav, next slide. When I interviewed them, they are just construction workers who were brought here in May to clear up these drains. And most of the cities, they do this job just before the arrival of monsoon. So in this case, as you can see, the exposure is not just limited to sanitation workers, because sanitation work is so informal. As Vishwanath already pointed out about the informality, I also want to talk about the extent of informality, right? So, and when you think about the extent of informality here, like how do we even address that? And if we may, is formality a solution? Formalizing sanitation work a solution? Not really, because it is not that easy to formalize the whole spectrum of sanitation work either. And as you can see, not only do they have to work in this hot sun, but they also have to eat and drink. And if you quickly go back to the previous slide, Gaurav, you can see that one more. You can see that people are actually selling food and eating food right there. And the paratas were being made and all of that. So just jump 2 slides forward, Gaurav. So in this case, the exposure is not just limited to sanitation workers. It extends to general public and also people who are not into this. Next slide, Gaurav. And this is another informality. So this worker was picked up from a liquor store and he does all types of work, including sanitation work. And even here, this is a clogged up stormwater drain in Hyderabad. So next slide. And this is in the peripheries of Bangalore, where we still have pits, as you can see, and in a neighborhood that can easily afford a better sanitation system. For example, a good, well-designed septic tank. Next slide, Gaurav. And the manual handling here that we are talking about, we should not just focus on sewage here. This is manual emptying of pits. If many of you have not observed, this is the, if you don't have trucks, or trucks, though trucks are available in Bangalore, there is still manual work, not to a large extent, but there are still people who do this manual work. Next slide. And you have to get into the pits and look at the exposure. It's like fresh feces coming out of the toilet, as you can see, as this guy is actually getting into the pit to clear the final sludge. Next slide. And this is also what I wanted to point out. I will come back to this slide particularly later on to point out the disparity in the society. At one end, you're using some, I don't want to call it as a primitive work. This is this work where they use bamboo strips to unclog sewers. On the other end, I don't know how many of you can see the BMW right next to it, you know, and it belongs to a government. If you closely observe the number plate, it is a government BMW. Right next to a work that is happening in such a primitive way. Yes, you cannot get into this into sewers these days, but still the work is done in such a way that sewer workers are exposed quite a bit. Next slide. And even where there is mechanization, we keep talking about, oh, we should introduce PPEs. And I have tried extensively in different cities, try to photograph sanitation work and understanding how PPEs are going to help these people. And as you can see, PPEs are not comfortable things to wear in a country like India, because they are not well designed, and the shoes that these people are wearing, they're just gumboots without any toe protection. And the gloves that these people are wearing are not of good quality gloves. They tear immediately. I will show it to you in the next photograph. And as you can see, people get uncomfortable and they remove gloves immediately. In the beginning, since they know that I'm photographing them, they wear it. And within like an hour or two, because I follow them for a whole day, since I'm an ethnographer, I follow them for weeks sometimes, and they just remove them because they are not comfortable at all wearing them. And there are issues with design. There are issues with even knowledge for that matter. Next slide, Gaurav. And so this is simple dust mask, which costs about 20 rupees. And it doesn't even fit most, it's huge. I don't know how many of you can properly see it in the image. The size is really big. It's not even fitting him properly. Next slide. And again, this is another sanitation work going on in slums where they're actually tying rope to a series of rods to actually desludge a set of manholes. And again, as you can see, those are kitchen gloves, which easily tear. So next slide. And coming back to what Vishwanath was talking about, the honeysuckers, this is another thing where mediation by mechanization makes people think that it is safer. Next slide. And they work with bare hands and foot. And next slide, Gaurav. And because of that, though they wash the pipes, they don't really wash their hands. So next slide. And this is another example of reuse, which again, Vishwanath brought out. So fecal sludge from septic tanks and also wastewater in most of the peripheral urban areas in India is very common to see. So it's always reused. Next slide. And we were also talking about the rural areas. And this is a toilet connected to a manure pit in a rural area close to Dharwad. Next slide. In this picture, I have zoomed in. I don't know how many of you can see the overflow from the toilet is actually connected to this manure pit. So with these pictures, I just want to go back. Gaurav, you can just go back to the very first slide as the background if need be, but otherwise it's fine. So I will just go back to this overall understanding of what sanitation work is in India. As you can see, it's very informal. The spectrum is really wide. Formalization alone is not going to help. Is COVID going to create a new opportunity to rethink about sanitation work? I don't think so, because India has had so many opportunities to rethink. Workers are dying every other day in India, but have we rethought how we do sanitation work or our sanitation systems? We still haven't done it. Yes, COVID seems to be an important part for the society, mostly because it is affecting people other than most of these sanitation workers are Dalits, by the way. So, and it's so interesting that we are talking about sanitation worker without really touching caste in India. So these people will continue to be affected. And I have a feeling that India's real social as well as the political character has been laid bare in the way we have been managing someone as key as migrant workers. Sanitation workers are, in a way, have been treated as disposable for a long time. And though several Dalit activists and NGOs have been fighting for them, this has not been something that the country has addressed voluntarily. Yes, several changes have happened. It's not that changes have not happened. Yes, now manual scavenging is illegal, and most of the ULSBs have been encouraged to bring in mechanization, and all of that change is slowly happening. But it is not that it is going to immediately change tomorrow, and because of COVID, sanitation work is going to change completely, is what my feeling is. The reason is this: good, safe sanitation work is very expensive. And as a society, I don't think we are prepared to pay for it. And also, there is no clear understanding of how much does sanitation really cost. And there is a huge issue of equity and affordability when it comes to sanitation itself. And most of the aspects of sanitation work is kind of cheap because everything is externalized, right? So Vishwanath knows this very well. And I think most of you is how waste is collected and disposed from our own pits. There is no real treatment. Sanitation workers, they don't get any health benefits or pension or any type of other things which a proper human being should have. And they retire without any any pension. So in that way, just like migrant workers, they work every day and they work really hard. And also our frontline health workers are also facing problems because of COVID. So in a way, I think that COVID is not only a good opportunity to rethink how to do sanitation, it provides us with an opportunity to rethink how do we build India as a society. It also makes us rethink what sanitation is about. It also makes us rethink what Indian agriculture system should be. And also data is a huge issue. All said and done, it's very essential that government starts sharing data as much as possible, and that is something that did not come up in our discussion. And when we talk about some of the most some of the countries that have, for example, the reason COVID is everywhere today is because China could not it did not share the data as fast as it could have, and that has led to so many problems. And in India, there are so many issues with respect to data alone. So in that sense, I would say that thinking about safer sanitation systems, thinking about worker safety, all of that is very essential, but it's also important to share more data related to how and where all of this expense related to sanitation systems are being collected. So it is very, very, very essential to rethink about that. And coming back to who should bear the cost, as I already pointed out, sanitation is very expensive, and it's very easy to imagine whatever is being sold is a very Western imagination of sanitation system. And now the rich countries themselves are rethinking how to do their sanitation system because their sanitation infrastructure is falling apart. While India is trying to build its sanitation infrastructure, we need to rethink and see in what way can we do it differently. So, and that critical thinking is not coming into sanity. And also the kind of solutions that are being sold to a country like India are like how most of these rich countries, they come and they fund us, including development banks. What type of infrastructure projects that get funded in India, it's very much conventional in nature, and it doesn't really consider the informality that exists in sanitation work. Yes, if you want to formalize sanitation work, when I interview sanitation workers in rich countries, the type of job description, training, on-the-job training, and the different sensors that they have to wear and how they have to work is very, 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 very different. And you cannot just translate that to India. And that has been some of the challenge for me, to make people understand that India doesn't have the capacity, doesn't have the type of finances, and today you can see that India is going to struggle if COVID is going to become a huge problem, because the focus when it comes to a country, as like when you think about development, it has been completely focused on developing infrastructure, developing economic opportunities, rather than thinking about social and also political aspects of development altogether. And in that sense, this has been the major problem for India. So we really need to rethink development, and sanitation, public health is the key challenge. Even when you think about government's own proposals, right? Like the kind of support that our finance ministries are announcing day in and day out, there has been very, very little focus on how to build our overall public health infrastructure, how to educate people. So in that sense, I want to end it by saying that just because of introducing more laws and norms is not going to solve the problem for sanitation workers. Enforcement has been a huge issue. Educating sanitation workers about the problem, because COVID is just a new thing. And as Dr. Sitaram pointed out, we are still trying to figure out to what extent can it actually affect workers or people in general, and it gets easily diluted, and research is still going on, and the detection cannot pinpoint out a particular household. It's a good way to figure out community transmission rather than figuring out which lane or which house and where it is doing, because it's very impractical. We cannot really do that. But pathogens have existed in wastewater for a long time. Pathogens have existed in human excreta for a long time, but we have never tried to focus on that. And now, just because elite are observing this, are also getting affected by this. Now COVID has become a huge thing. So in that way, I really think that the society has to step back and rethink and stop, in a way, treating sanitation workers as disposable workers. And the effect, as also Vishwanath pointed out, is going to compound itself because of the reuse aspects also. Wastewater directly being pumped out, sludge being directly used, and things like that. So this is a great time for us to rethink as a society and see where we can go from here.
Thank you, Sharda. Thank you for what has been a very, very passionate and engaging discussion on the plight of sanitation workers and how, as a society, we need rethinking around not just aspects of development, but sanitation, and as a society as a whole, as to who we are and what matters to us, what is so important to us. I'm acutely aware of the fact that we have exceeded the time by 1 minute to be precise. And if our speakers and participants are okay, I would like to take in some of the questions which have already come in, and we've taken note of that. And I would like to direct those questions to our speakers. So if you are okay with the 15-minute or so Indian stretchable time extension to this webinar, that would be great. That would help us to take up some of the questions that have been brought forward. Is that all right? I'm taking silence as a yes, as one always should. So quickly going on, we received a host of questions even during the registration process, really, and some of them have been answered. But there have been several questions around the protocol and the SOP for testing. And for those questions, or rather the answers to that, I would request participants who have joined in today to please visit the Susanna India Chapter Discussion Forum. I understand the link for that discussion has been propped up on the chat box as well. You'll find quite a few answers to those questions around the protocols and the SOPs. So what I would like to do is to take up a few other additional questions that have been raised today, and some in the registration forum. A brief question really, part of which has been already answered by Vishwanath, was from Ruchika from IRC, and she was asking about, has testing been undertaken in places with known cases? If one of the panel members could briefly touch upon, is testing affordable for the ULBs? And I think Malini had some figures about testing, yeah? If Malini or Vishwanath would like to take this up about, whether, you think it's testing for COVID in sewage would be affordable for the ULBs?
Well, for the moment, a series of tests were done in the 28 STPs of the BWSSB. This was done gratis by a government institution. I'm sure we can set up protocols for testing to become affordable to ULBs. It's a question of figuring out whether the state is willing to fund this testing or not.
I'd just like to add. I'd just like to add to that. In my view, testing is very affordable because the private accredited labs that we are in touch with have, for one sample, quoted the price of 4,500. But there are also several government accredited labs, and Telangana has given us a go-ahead, and we are in negotiating. So I think in terms of costs are very, very less as compared to the potential of not being able to predict the prevalence of the virus.
Thank you, Malini and Vishwanath. The next question from our colleague in World Vision, Anupam Abhishek, is, will a testing protocol for COVID in sewage be applicable in rural areas?
Do you want me to take that, Sunitra?
Yeah, would you please? So I'm opening the questions to all the panel members. Whoever wishes to take them up, please.
Yeah, I can only talk from the Karnataka context, which I'm very familiar with, and some amount of Tamil Nadu and Andhra Pradesh. In terms of the rural sanitation, the twin leach pit has been mandated and has been run as part of the government Swachh Bharat Abhiyan. About 120 million such toilets have been built. Now, if it's the twin leach pit, which is an individual toilet, I don't think that there's any need for any testing at all. The testing of the people would be as easy as testing, getting into the pit and testing it. It's only in communities and in wastewater treatment plants that you test, because you want to establish what the risk is in the overall community without having to go to every individual and test. So I don't think testing will be relevant in the rural context in India.
Thanks, Vishwanath. Another question coming in has been, this was a question from the Indian Institute of Human Settlements, and our friend there, Dhanik Narayan, asks, is there a consensus amongst various stakeholders in the wash sector on testing for COVID in sewage? And if panelists can also provide their thoughts on the necessity and its reliability. If one of you would please take this up again. If there is, so I guess the question is there a consensus, general consensus in the watch sector, be it in India or elsewhere, that this is a necessity, and if indeed one can vouch for its reliability?
I'm not so sure that the watch sector comes to a consensus so easily, and that too when something's been
as it shouldn't, Vishwanath.
For sure, the disparate views are always welcome, and some consensus will eventually emerge. I'm sure that the zeal for the testing is now coming from academics who are trying to establish this as a frontier science for establishing risk, right? So this is where it's coming from Australia or from the Netherlands, where actually the testing has been done and then it's being sort of propagated. Unfortunately, intellectual ideas march way ahead of practical realities on the ground. So I'm not so sure that we haven't even got the basics of testing for wastewater or sewage right in our wastewater treatment plants. So to layer on COVID-19 and say that it has to be done will be stretching things a bit far for now.
Thanks again, Vishwanath. Last couple of questions, really. I think we'll probably just be able to take one or two more. One on, how is testing possible given the fragmented nature of sewage systems and the usage of disinfectants in toilets? If one of you would please take this up.
I'd like to say something here. This somehow in India, this polluter pay principle is still not ingrained. In one of the towns that we are working, the COVID designated hospital has no treatment system, and it lets out all the waste into a drain right opposite the front gate of the municipal corporation. I mean, this is unpardonable. And I think as institutions should be mandated to have treatment systems for wastewater with or without COVID. The point.
Malini, if I may, I think one of our participants,
Sorry
something about quality.
So, Gail, can you hear me now? Am I audible? Not so much. So the point I'm trying to make is that we should look at this as an opportunity. When we have COVID or any other virus, can we look at it as an opportunity to implement some systems in the municipalities, some sensitivity about the importance of data, importance of testing, importance of monitoring? Because today it is COVID. Believe me, in 1 month's time, it's going to be dengue. Another month's time, it's going to be cholera because we're going to be flooded across the country. So this discipline of monitoring, this discipline of establishing surveillance systems will have to be brought in. And unfortunately, disasters are the perfect time to bring this. So I think we need to start sensitizing our ULP. And it's not about being mandated by the central government, but coaching our cities and state governments about the importance of monitoring and predictive modeling, etc.
Yeah, just to add to that, to Malini's comments. So see, when the country is in a state of shock, it's so easy to bring in new things. And I think government should focus on kind of things that Malini has actually highlighted, but our government is so focused on privatizing things and bailing out companies and bringing in more foreign direct investment. So that is where my problem has been. We should treat this crisis as a huge opportunity to really build the very foundations of our society. Instead, the focus has been very superficial, and the government is trying to use this opportunity to do things that are not really going to help the society in the long term.
Can I add?
Yeah.
Absolutely, Vishwanath, go ahead.
Yeah. So I'll leave it to Dr. Sitaram, please.
I just wanted to second what both Malini and Shata Prasad said. Now, at this point of time, consensus around testing for a patient itself is still not there. We have so many views, and testing for the active cases and their contacts is still a controversy. So such being the case, the consensus on testing samples which have not really been proven to be effective is still some time, in the future. Also, when we look at the age of the pandemic, it is still raging. The concerns are actually a bit different right now for all stakeholders, and so we're still looking at survival. We're still looking at coping mechanisms for the actual patient themselves. Fecal testing and sewage testing, etc., are probably not very high on the priority, which is unfortunate. And unless we take a real hard look at the systems, see where we are failing in general, not necessarily limiting to the COVID-19 disease or the SARS-CoV-2 itself, but in general, and see that, look at this as an opportunity to strengthen the system. I think unless we do that, we will be actually losing out a great opportunity. So this is when we have to come together and highlight these challenges and use this as a tool or an opportunity for system changes. In fact, Malini was very right in highlighting hospitals, waste as one of the important sources of spread of infection, let alone the fecal matter. Some studies have actually shown the presence of active viruses on masks that the hospital staff have been using even at the end of 7 days. So it's a big concern. So the risks are all over, and we need to look at it from a larger perspective of how we strengthen systems and better practices.
I'd just like to quickly respond to Yale's point about whether disinfecting toilets will eliminate the RNA and make the test unreliable. Well, I think it's a trade-off between public health and reliability of the test. I would be leaning towards the former. Because we can't afford to wait for test results to come and our analysis to share something. I think it's from the point of public health, it's important because we know that disinfection would kill the virus. It's important that we take up disinfection and then take up the study. So therefore, sampling becomes extremely important. And starting at COVID containment zones or red zones, as we call it, I think that will be a good start point. And we are discussing how to frame our sampling right now.
Thanks, Malini. I'm afraid we're really running out of time. I know I promised us all 15-minute Indian stretchable time grace, but we're almost at the close of that. This has indeed been a very, very engaging discussion. And, unfortunately, owing to the paucity of time, I'm not sure we'll be able to cover all the other questions. I will, however, encourage everyone who has joined us today to please, raise them on the online platform of Susanna India chapter and, contribute to that discussion there, which is ongoing there. And the next one is scheduled from tomorrow, if I remember correctly. To sum up, this very interesting discussion that has been taking place today, what we have clearly heard our speakers saying is that, COVID is an opportunity to rethink sanitation, and that now is the time for thinking around systemic changes, and this was clearly highlighted by Sharda in his very impassioned discussion around the plight of sanitation workers. What we've heard today is that, the implications of finding the virus in sewage is indeed significant. And we need to take universal precautions and follow standard protocols to mitigate the public health risks. Our speakers, Malini and Vishwanath, have also impressed upon the fact that, that there are indeed advantages of testing, and that monitoring needs to be put a very, very high value, not just in the context of COVID, but for any public health emergencies that often does tend to arise in our country, be it the occasional flooding or the dengue, or, God forbid, a cholera, as Malini pointed out rightly. What we need is, to work on the willingness of city and state governments to test and communicate those results to the public without, of course, causing a mass panic. Policy push is clearly needed at the national level. The only guidance that we have is from the central government now in the form of a circular, and this is not mandatory, but some water utilities are, of course, following the same. This suggests that we need measures to disinfect wastewater, and of course, we need protection for STP workers and sanitation workers. Vishwanath rightly pointed out that we need to develop a risk matrix to assess the challenges posed by COVID-19 and other emerging viruses on the water resources of a city or of a locality. Sanitation workers, who are mostly informal workers and they work in the informal sector and are usually in close proximity with the general public, and what affects them, therefore it certainly affects the public, and therefore their health and their safety becomes absolutely paramount. With that, I would like to again, on behalf of the organizing team and all the organizations who organized this webinar, I would like to thank all our panelists, Dr. Sitaraman, my apologies, Dr. Sitaram, Malini, Vishwanath, and Sharda for joining us today. A profuse thanks to all our participants for joining the webinar and actively contributing to this. My apologies for not being able to take up all of your questions. We've completely run out of time. And with that, I would now like to hand over to Mr. Nitya Jacob to discuss the next steps and wrap up the webinar. Thank you all.
Hi, good evening, everyone. Thank you, Sunetra, for an extremely, and the speakers for an extremely interesting webinar, very informative, and I think several nice conclusions from there. We've covered an important aspect on the of the issue of testing for coronavirus in sewage. But I think more importantly, the webinar examined issues of how to engage with policymakers and officials, as well as the technical staff and sanitation workers in urban local bodies. I think the critical part is that once a protocol is developed, it is these people who will have to actually come out with policies and execute the protocols for testing. At the start of the webinar, we had mentioned that there's a thematic discussion on Susanna, and we just put the link on in the chat box here for everyone. If you are already a Susanna member, I would request you to kindly log in and contribute to that, because we're trying to really build up India-specific kind of a method of testing for COVID and seeing how it could actually be an early warning system. We are going to work on combining the two documents, the results of the learnings from the webinar itself and from the thematic discussion, and bring out one consolidated document, which again we'll share back on the Susanna network. And yes, we'll be also providing a link to the recording of the webinar. So once again, I'd like to thank everybody for attending, and I hope we will see you on the online discussion as well. So with that, I would like to close this webinar. Thank you.
Yeah, one second. Can we all switch our cameras on and take a group picture? Can all of us please switch on our cameras? That'll be nice. All the participants, all of us, please. I don't see people switching on their cameras. I think you all do not want a picture. All right, no issues. Yeah, Nitya,
No, Shruti, I think I see many people who have indeed turned on their cameras, except for 71572. So if you can somehow arrange for this photograph.
Yes. Sunita, if you can see all of them, I cannot see all the cameras open. If you can see all of them,
I see them as a panel right on top, and that's the problem. But
yes.
For that, we need everyone in that one space.
Yes, a lot many people. Yes.
Yeah, Gaurav needs to.
But Gaurav cannot because he's operating. Yeah, so he cannot take the screenshot. Someone who can see all of that can take a screenshot.
I can see only when I scroll through. I don't see everyone in one. Let's
You
see.
perhaps have to
All of
take
you-
multiple screenshots.
Okay, I can take a screenshot. Can you please all smile?
Sure.
Are we smiling enough, Paresh?
Just a moment. I'll just post this to Nitya.